So, good afternoon to all. It's a great pleasure to welcome you for this, I would say, almost last session. Indeed, we will have two sessions back to back, a series of presentations, and then roundtables where we will be discussing some of the element of the challenges of this session. It's a great pleasure to have one remote expert and two excellent experts in the room. I will start by a short introduction on this session. So it's really, the question is moving ahead. So how can we do to ensure that we can address the current legal challenges in, I would say, at national level and European level. So what are the challenges we need to address to support research, to facilitate research? And as we have seen before, for those who were here in the first session this afternoon, it's not a theoretical element. It's really about saving lives. And we cannot afford to have, for rare cancer, some cancers where the rate of remission doesn't change over decades. It's insane. And we have the possibility to change it. We have the possibility to solve it. So we need to find solutions. We need to engage and to take it seriously. It's not because if it's rare that it should be disregarded. It's something that should be really a priority, I think, for all of us. We will have as I mentioned, excellent experts to join us, to discuss, to share some perspective and to engage. We have Guillaume Byk, who is the Legal and Policy Officer at the European Commission for DG Health. And it's a great pleasure to welcome you, Guillaume. We have Tina Chavoski, who is a lawyer for the Swedish eHealth agency. It's a great pleasure again to have another perspective from the national agency. And Sigrun Gittrup, who is from the Danish Health Data Authority. So again, the other perspective to ensure that we have the different perspective, a kind of almost 360 degrees perspective on how to address this need to facilitate data sharing for research in rare cancer and in other fields of research. Let me share with you a few introductory slides before giving the floor to Guillaume Byk. In the context of ID for RC, the fundamental idea of the project is how to facilitate data sharing, how to facilitate the interface between the researchers on one side and the patients on the other side. And in this context, there are different technological challenges, but a fundamental challenge we need to address is regulatory compliance. It's not to oppose, it's to ensure full compliance and to find creative solutions to ensure, on one hand, full respect of personal data protection, and on the other hand, to enable researchers to do their job, to do their work, which is, again, to do research and to save lives. So we need really to find the right connection, the right balance between the two. It's very much about finding technical and organizational solutions to ensure that we have this adequate combination of measures to protect the fundamental rights to privacy, but at the same time to ensure that we do not ignore the fundamental right to life. And that's what researchers are trying to do, is to ensure that we can save lives, and for this we need to have data, special categories of data, to be able to use them to save lives today and in the future. One approach that was presented earlier today, we have some technical solutions which are emerging from ID4SC. Federated machine learning is one way. It's a very smart way. It's a very interesting way. It has a huge potential and a very important development in ID4SC to bring dedicated solution, technical solution to facilitate this sharing of data. But we need at the same time to address other aspects. So we mentioned the question also of ethics, to build trust among the different stakeholders. And for these, ethics is an important element to ensure that what we are doing, what the different stakeholders, what the researchers are doing is aligned with these fundamental requirements to ensure that it is done for a good cause. That again, ethics is a fundamental element. How to demonstrate ethics, it's not easy. And one of the target that ID4SC addressed is how to develop this notion of ethics by design. The same way we have in the GDPR, data protection by design. The idea was to say, how could we define and specify a notion of ethics by design? And that's one of the important outcomes of the project, among other outcomes. And the idea was to find a way which is as objective and as neutral as possible. So what we did, we worked on over 50 international norms, standards, regulations, regional regulations, European standards and regulations to extract the most preeminent requirements. And out of it, we extracted 22 criteria or principles that can be assessed in terms of compliance to ensure that when we do research, but also in other domains, other fields of activities, that we can assess data processing and activity against these 22 principles, which are fundamentally clustered around transparency and accountability, rule of law and equality of treatment, and duty to care and protect. And there you just have a partial mapping, about 10 different norms and regulations over the 52 which were analyzed to see that each principle is mapped with other different regulations, different standards, different norms, regional or international norms. And this is leading to a new certification model, which is named Ethical Cert, that will be one of the output of the project. But beyond the certification, there's a question of regulatory compliance. While certification is something which is required and expected, it's not necessarily a legal obligation. But when you process data, you need to comply with the GDPR. You need to comply with the different regulation. We will now have with the European Health Data Space new opportunities, but also a certain number of obligations we need to comply with. So the question of how to ensure compliance with the regulation was one as sort of the main concern and objective of ID4SC, because without addressing these legal obligations, we cannot do research, we cannot share data. We have the case, if I may mention it, I will not mention the project to give some anonymity, but the case of in one of the European research on medical data, an Italian hospital where two branches of the hospital didn't want to share personal data within the same hospital because they were afraid to breach the law. So there is a lot of effort to make this process easier, because if you cannot share data within a single hospital, just imagine what it means when you are a researcher and you want to have data from a hospital from another country. So that's something we need to address seriously. So one of the elements we did is also to develop something which has been developed already in the research program to translate legal obligation into auditable criteria. And this has successfully led to the adoption by the European Commission, by the EDPB, of the first European Data Protection Seal under GDPR, which is a formal certification to assess compliance with the GDPR obligation. This has been extended recently by another European research project to turn it global. So not to focus only on Europe, but to have the equivalent of the European seal, but made available globally to address also the Convention 108 plus of the Council of Europe, to address the Malabo Convention in Africa, so different regulation. Again, with this idea to translate norms, legal norms or conventions, which may be complex to understand for non-lawyers, into easily implementable criteria. And this has been extended to other regulation. And currently, we have a very interesting development. That's why I wanted to mention it. In a project named Protect Child, there is ongoing work to also translate the EHDS into auditable criteria. So also to enable researchers, to enable data centers to easily assess the level of compliance with the regulation without being lawyers. So really translating, again, the legal obligation into something easy to understand and easy to apply to assess the level of compliance. Other developments from other projects, for instance, DPID was a development from different research projects. Currently, it's supported by the Slices, one of the Slices project, which enables to share information about data processing in line with Article 12 and 13 of the GDPR. So a lot of development, and we heard us on the technical side, so different elements which are emerging. And again, ID4AC is a catalyst to bring these solutions to the table and to find, I would say, a portfolio of different solutions to ensure that data can more easily be shared. We had last week the Privacy Symposium in Venice, where we had the chance to have the European Commissioner for DG Justice, we have DG Santé, DG Connect, different European institutions which were present, EDPB, DPS, FRA. And we had part of the program was on medical data. We had the great chance to have the pleasure to have Annalisa Trama, to have many of our colleagues for ID4SC, Eugenio, and some elements which came out of this discussion. Everybody wants to do things right. Everybody wants to ensure that nobody in the research community so far, I never heard someone saying, oh, we want to breach the privacy of people, or we want to breach the fundamental rights. I don't know anybody who has this kind of bad intent in the research community. Maybe some exist, but I don't know any of them. And clearly, the question is, how can we ensure that we can leverage on EHDS? And is EHDS enough for the researchers? Do we need, if you have a research project, European research project, and different researchers working together, do we need to go through EHDS to share data? Couldn't we find more efficient, practical manner to share this data without going through the whole process of EHDS? And can we really have access to all the data, the information we need? Do we have enough information in EHDS to do the research? Do we have enough metadata? Do we know exactly what are the data behind the data set? So quite a number of questions. But there were a few elements which were quite a kind of summary, main takeaways. Building trust was something which was mentioned quite a number of times. We need to build trust among the different stakeholders, among the patients and the researchers, but also with the authorities, with the regulators. We need to have everybody on board. We cannot afford to divide. Again, it's about saving life. It's not about making our life more comfortable. It's really something very fundamental, very important. Raising awareness. Many people do not understand the problem that face the researchers. So we need to ensure that we can communicate, we can raise awareness on what are the challenges and to bring solutions to the table to solve these challenges. To have coordinated approach. We cannot afford having legal basis for medical research in a country and then completely different legal basis in another country, or to have the regulator working in their side, the researcher on their side. We need to bring everybody on board and to work together to find solution. We need to have a better I would say risk and a role allocation of the different entities. Who is in charge of what? Can we ask a researcher to do a legal analysis? It's not really reasonable. So we need to find a way to simplify again the work, the process. Cybersecurity is an important element, of course, and we all want to protect the data which are processed and to have simplified procedures. We need really, in line with the Draghi report, in line with the new vision of the European Commission, let's walk the talk. Let's ensure that we protect fundamental rights, we protect privacy, but we enable researchers to do their work and finding practical solution to make it happen and to get rid of the hurdles and the barriers for the researchers. So for this, without any further ado, we have the pleasure, as I mentioned, to have excellent experts, authorities, and speakers. And I'd like to give the floor to Guillaume Byk from Luxembourg. Thank you very much for joining us from remote. It's a great opportunity. We know that everyone, in particular DG Santé, DG Health, is trying to do its best to support us. So the floor is yours. And if at the end of your presentation, you could already perhaps share some of your visions, how can we move forward to overcome the current barriers for research? So Guillaume, the floor is yours.
I mean, I think there's some points that you raised, and I will try to also to reply to some of them during this short presentation. So yeah, I'm here to talk about the European Health Data Space Regulation, and really the creation of the European Health Data Space, in particular for secondary use, and where we stand, what is the goal of this regulation, and what some of the legal challenge we can face in that, legal privacy challenge, and the future for how to implement it. So first of all, just a very quick presentation of this regulation, what it's really about. I mean, as you indicated earlier on, that really at the moment you have a fragmented access system across national country for the access to health data for secondary use. And you have different rules, you have different type of data made available for different purpose, with different conditions. So it is quite a complex system to navigate. What the EHDS regulation does for secondary use is really to provide a common framework to address this fragmentation. So it would be the same requirement for the same purpose, the same type of data you can have access to all across Europe. And this is really a game changer. So there will be a clear procedure and clear expectation of researchers when they want to access data. So it's not more like, oh, I need to have this type of document for in France, I have to have this Germany, it would take that long in Norway, in Denmark, it would take, it would be shorter in Belgium, it would cost that much in Luxembourg, it could cost differently in other countries. So it's really a common framework. You really have one, actually also very important, you do one application. And then this application is basically transferred to all the health and access body across Europe, where you actually request the data set, and each of them will do an independent assessment. And this is very important to notice there is you may have some countries saying yes, and some other countries saying no, because it's each time it's a really an independent assessment of your request. So this is really one game changer. The second thing which is important, and you mentioned ethics, privacy, the EHDS framework is in compliance with the GDPR and the ethical requirement. And that's also very important. What the EHDS regulation does is actually harness all the flexibility that can be provided by the GDPR in relationship to secondary use. But what happened with the GDPR is basically, in a case-by-case basis, you have to explain, you have to confirm that the type of measure that you are putting into place are actually enough to comply with the GDPR requirement. And that can be a cumbersome way. What the EHDS regulation does here is actually say, well, look, we have this framework, and this framework does comply. So if you actually follow and actually get your data, access to the data through this framework, you're also in compliance with the GDPR. So this is a very strong system where basically it's not like you don't have to comply with the GDPR, but it helps you to actually comply with the GDPR in the fact that basically it's a framework that does comply with the GDPR. And the same with ethical requirement. There is an element on ethical requirement and ethical request element there with the EHDS, which help you out to actually comply with national ethics requirement. So as you can see there, it's quite an interesting setup and framework for researchers to do their work, more importantly at the European level. And you do need that because, as for example, you mentioned rare cancer. I mean, some cancer can be rare across in one member state, but across Europe, they may not be so rare anymore. And by pulling the data of all these rare cancer patients across Europe, you actually do get a more sizable data pool that where you can actually access the data. Now, one thing which has to be also very important, we're talking about accessing the data. So you can actually access the data in a secure processing environment, which means that you're not really sharing the data. It's not like, oh, we give you a copy of the data and then you can use it. You are really accessing the data in a controlled environment, IT environment, and this controlled IT environment is controlled by the health data access body. And this one of the key features here to also to promote trust, because it's not so much you don't trust the researchers, but basically you have an independent authority, which is the health data access body, which is actually monitoring and controlling the situation. Now, after this broad overview, of course, of this regulation And if you want to have more information, you can actually always go to a series of webinars we organized early on this year, where we explain in more detail how the whole EHDS framework works. I would like to highlight two interesting legal privacy challenges that we have. The first one is, and I think an important one, the element of opt-out in EHDS. I mean, that's something actually what's very important for the European Parliament, and how it's different from consent, right to object under the GDPR. So, you have under the EHDS regulation, natural persons have the right to opt out from the secondary use of data to the EHDS. What it means is that if someone doesn't want the data to be made available to the EHDS framework, you can say, I don't want this data, my data to be made available. In addition, I have to mention that the fact that there is a possibility to break through this opt-out if member states choose to do so. So for some type of user and for some type of purpose, we can actually say, mostly for public good purpose, you can actually but punch through this opt-out. So that's for each member state to implement at national level. Now, how this is different from the right to object under the GDPR and to the element of consent. First of all, in relationship to consent, consent is a legal basis for the processing of data. Here, we're not talking about legal basis for the processing of data. We're talking about whether this data is made available to the EHDS framework. So it's really a different thing. It's not a legal basis itself. The legal basis for the EHDS, for the use of data through the EHDS regulation, is the regulation itself and how it's actually being implemented. So that's the first thing. So it's not a consent. You're not actually talking about consenting as a legal basis. And as regarding to the right to object under the GDPR, the right to object under the GDPR is actually more limited than the right to opt out in the EHDS. For one thing, the right to object has to be justified under the GDPR. The right to opt out in the EHDS does not. In the EHDS, you don't have to say why you're opting out. It can be for any reason whatsoever. So that's really a very powerful thing. But again, this opt-out is only for the use of your data within the EHDS. It's not because you're opting out from the EHDS, means that you're opting out from everything, or from secondary use of the data for research in other type of framework. It's only the use of this data within the EHDS. So that's one of the interesting privacy challenge, to actually make sure that people do not confuse these different concepts from the EHDS and from the GDPR. Another legal challenge, which actually is quite important, especially for innovators, is the balance between IPR protection and access to the electronic health data in the EHDS, under the EHDS framework. What have to be said here is that the EHDS regulations say that IP protected elements such and also elements protected by trade secret or by clinical trial data regulation can be accessed under certain conditions and under certain element to the EHDS framework. So what it actually means that these IPR protection or trade secret protection should not be an obstacle for the access to this data. However, what also one thing is clear is that the EHDS framework should not be used to actually infringe on this right. So it's a balance between this protection and this legitimate need to actually have access to the data. And what will happen is the eHealth Data Access Body will actually try to coincide to make sure that these two elements that can be sometimes conflicting can be managed and can happen. So we'll try to find a way to actually provide access to this IPR protected data to the health data user within the secure processing environment. And in some cases, of course, it may not be possible. And then in this case, the health data access body will say, sorry to the data user, these rights are protected and there's no practical way for you to have access to the data. And in some of the cases, the health data access body will say, well, I found a way and I will allow this access to the data. But of course, there will be some challenge, practical, operational, legal challenge in how this thing will happen. So I think this is just to give you some ideas of some of the issues that we can actually face through the EHDS implementation there, but we'll get there, and we do believe that it's not insurmountable, and there will be practical implementation that actually provide guidance and solutions to the issue. One final thing, and to link up with the next intervention, is the more operational challenge of implementing the EHDS regulation itself. There's, for at least for the European Commission, there's more than 20 implementing and delegated acts that need to be set up to actually ensure the smooth operation of the EHDS regulation. So as you may imagine, it's a quite tall challenge. In addition, there is a very ambitious time frame to ensure that we have implemented all these elements. Some of the elements will come in application within 2 years from now. Some of the elements will become, like mostly the key element in primary and secondary use will become in application 4 years from now. And then also at 6 years, there will be additional elements, for example, for secondary use, access to genetic data through the EHDS. So it's a very challenging operational-wise time frame, and of course we will make sure that this needs to happen. In addition, as I mentioned, for example, for opt-out, the member states have to implement some, make some choice and implement some element at national level. So, for example, the member state will have to nominate health data access body. So they have to actually either say, if they already have some form of institution doing this kind of work, to actually saying officially, these will also deal with the EHDS regulation. And for some others which do not, they will have to create them, and actually also to set up the legal framework to make their operation possible. So I think I will stop there because I think it's already quite a lot, and we would like to have time for the following conversion to happen. If you have additional time for questioning and debate later on. Thank you very much.
Thank you very much, Guillaume. Very interesting, very good presentation. And we know it's a challenging period, and we all hope that together we can make it successful and make EHDS a useful and powerful tool.